GPs will have a range of sampling devices available. One of the most commonly used devices is the Cervix Broom. They'll also have an endocervical brush at hand, a combi brush, and a plastic spatula. So the important point is that when sampling from the cervix with the Cervix Broom, the broom needs to be well applied to the ectocervix, or the outer part of the cervix, throughout at least 3 rotations, up to 5. And that will really optimise the amount of cells that are picked up from the surface of the cervix. The sampling brush should then be placed into the liquid medium, and it's important to ensure that as much cellular material as possible is released into the liquid. We need about 5,000 cells in the liquid to actually read a reflex cytology. And so we ask GPs to rotate at least 10 times, pushing the brush hard up against the sides and the bottom of the vial to help release that material from the bristles. An endocervical brush should be added when you're taking a sample from all postmenopausal women. The endocervical brush should be inserted into the os of the cervix so that the bottom bristles are still visible, and a quarter or half turn is actually sufficient to obtain the cellular material that is required. A combi brush can replace the combination of the cervix brush and the endocervical brush. It has an extended tip. However, the combi brush should only ever be rotated a maximum of 2 times. And some GPs are still using the plastic spatula, which is absolutely fine. Plastic spatula needs to be well applied to the surface of the cervix and should be rotated at least once, up to twice, with good contact throughout.